Hello, I'm Alyce Adams. I'm the Stanford Medicine Innovation Professor and Associate Director for Community Outreach and Engagement for the Stanford Cancer Institute. I am a co-investigator in the Upstream Center, where I co-lead the Upstream pilot program with Professor Bob Hyatt from UCSF. Today, I have the honor of interviewing one of our past outstanding pilot awardees, Dr. Caitlin Ahearn, a research scientist now at Meta. Welcome, Caitlin.
Thank you. I'm so glad to be here and talking to you today.
Thanks so much. Well, why don't we start by you just telling us a little bit about the project that you did with us when you were with an Upstream pilot award?
Yeah, so my Upstream pilot grant was interested in understanding the impacts of guaranteed income, so cash transfer programs. And specifically, it was a project that studied, or it's an ongoing project that studies the impact of receiving guaranteed income for 12 to 18 months on I'm trying to think about how to say this, the buffering effect of that guaranteed income on against unexpected shocks that people experience. So this was the California Guaranteed Income Pilot Program that gives low-income pregnant individuals and former foster care youth about $800 to $1,200 a month for 12 to 18 months. And the goal here was to understand what unexpected shocks to their household, maybe to their income, for example, they experienced, and whether receiving this guaranteed income reduced or buffered the impacts of those unexpected shocks on kind of their downstream health effects.
Oh, super interesting. So, for example, if somebody lost their job or something like that after they received this, you're looking to see what the impact of that might have been in terms of the extent to which receiving this particular program benefited them in terms of helping them to manage that particular loss. Is that
Yeah.
accurate? Oh,
Yeah, so it's a little bit complicated, but
yeah, but no, super interesting though. Very interesting. What
Mhm.
motivated you to apply for the pilot grant?
So I was motivated to do this. We were already kind of working on a project with the California Guaranteed Income pilot programs. And we were very interested in this idea of guaranteed income as kind of a bulwark against these unexpected shocks that people experience in their lives, especially in the low-income population. Um, and so my goal was to use this kind of existing relationship we had with the program to add additional items to surveys to better understand and test this theory that guaranteed income can kind of bolster people against this like onslaught of shocks that they experience.
Oh, that's really interesting. So while you're working on the project, is there something that surprised you, or what were you most excited about as you were working on the project?
I would say I was most excited about having the opportunity to develop these questions and actually be some of the first people to specifically study this topic. So I think with guaranteed income research, it's kind of implicitly assumed that you're going to be buffering and smoothing income shocks. Um,
Mm,
but I think explicitly examining what shocks these households are experiencing, because there's very little research on that specifically,
mm,
studying these populations, which are of great interest, and specifically asking like what what shocks they experience, and then being able to really see how people, we're going to assume that people are experiencing shocks in both the treatment and the control group, and understanding whether the treatment is really helping people weather these shocks, right? Which is something I
mhm.
think that comes out a lot in qualitative work, but there's less quantitative statistical analysis understanding this question. So I think that's what I was most excited about, was being kind of at the forefront of that work.
Fantastic and very upstream, right? Very preventative rather than seeing
Yes.
what happens after the fact. We're saying, what if you do these things early on? How does it help people sort of throughout their lives? And it's fantastic.
Yes, absolutely.
So, as you know, as part of Upstream, we're very committed to engaging communities and other decision makers and those affected by the research in the research. And so I'm curious about how much experience you had engaging with community during your work on the pilot project and what that experience was like.
Yeah, so as an Upstream pilot, I actually think or sorry, as an Upstream pilot project recipient, this was a place where I dropped the ball a little bit. I think the project we were working on was already a little bit established, and there was already kind of a community um,
Mhm.
group that vetted questions that we didn't really have a lot of interaction with. And I think in developing the questions and in developing the framework for this work, I think I could have done more. And in hindsight, I'm like, oh man, I should have engaged the community a little bit more for the actual research I was doing. But I will say I highly, highly valued the engagement with the community that I got through the Upstream meetings and convenings that we had. So the one that stands out the most to me was right before I left Stanford, we got to go to UC Davis and tour the surrounding area and meet people who are on the ground working to support people in the community. And I think it just really just plus one for including community in this because it really grounds the work. And it's something that, yeah, like I said, I just think I dropped the ball a little bit in my own work for this, but I was so grateful to have that incorporation as a pilot recipient, a pilot grant recipient. And I think it really did help kind of remind me of why we're doing this work and its value.
Oh, great. So it sounds like, I mean, the upstream infrastructure of having community already present was helpful in the sense that they had already given input into the survey itself, but that you would wish you had other opportunities. I'm curious, so to take that forward for other people who are applying now, would you give them any advice about that or any other aspect of applying to the program?
Yeah, absolutely. So I think the community that was already involved was actually through the Guaranteed Income Pilot Program. So they had that community. And I think for advice for someone applying for this program or who's a new pilot recipient, um, work to incorporate the community. I think it's worth the effort, and I think even if it's just having a few conversations with people about, oh, what's been your experience, like in my case, with unexpected expenses or with an unexpected income, household income reduction that you had, how could like a steady flow of income maybe help you through that time? And just, I mean, I think if I was still at Stanford, I would have incorporated a little bit more of this work as we um, started getting results and for contextualizing what we were finding. But I think it's just so important to ground the work. And so my advice is just, even if it's hard, even if it's putting yourself out there in ways you're not used to doing, even if it's a community that you're not used to interacting with, it really is worth it because those communities are why we're doing this kind of work.
Fantastic. Thank you so much, Caitlin. Anything else you want to leave us with before we end?
I don't think so. I just want to say how grateful I am to have been a part of the Upstream community. It really shaped a lot of my work at Stanford, and I was so glad to have been a recipient of this pilot grant. And I'm so glad to hear that it's continuing on. And good luck to all future applicants.
Thank you so much, Caitlin, and congratulations again on your new role. And thanks so much for talking with us today.
Thank you so much.
Take care.